Thank you, Representative Reyes, and thank you for holding this forum on this important issue and for sharing your personal story and bringing together people who can share their own stories of men in their lives who have gone through and deal with this condition. So I think one thing we all know is that we're all trying to advocate for health and public health. And there's often been a focus on women's health, on children's health, recently mental health, various aspects of health. And I think for many men, although we obviously support the men in our lives and want to advocate for them, for many men, personally, there's a lot of machismo, would we say, right? And a lot of feeling like they have the ability to try to stand up and protect others. And I think women often come together in moments of crisis and find each other and create support groups. And it's not that men don't do this, but because many men feel they should be able to deal with these things on their own, they may not reach out to others and realize that they're not alone. And really, none of us wants to suffer alone. None of us should worry alone in life. And when men are trying to face their own health issues, first, I think one of the things that's been brought up here is some have commented particularly about how they had no symptoms. Well, how is prostate cancer screened for? There is a blood test called a PSA, and it has its strengths and weaknesses. Sometimes it can be a little bit up, and it's a false positive. There are times it could be a false negative. And really what you want to do, though, is talk with your doctor. Go in for that yearly visit to be able to determine, should you really get a PSA? And is the doctor going to be able to help advise you on what to do with the results of that PSA, should it be elevated? So this is really one of these joint decision-making, shared decision-making issues that come up in medicine. But the most important thing is to realize that we're all vulnerable, that we all need to take care of our own health, and we should go in to be able to evaluate whether you need a test and then what's going to be done if that test shows that you're elevated. Now, one of the other things we also recognize is that there's several groups of people, particularly those that have been most disadvantaged in our communities, who repeatedly have the consequences of ill health come in front of them over and over again. And so for many of our Black and brown populations, this is also the case when it comes to breast cancer. When we look at national averages, we can say that Black men are 1.7 times more likely to be diagnosed and 2.1 times more likely to die from prostate cancer. When we look at Hispanic men, the same is true, where the rates are higher as well. 1 in 5 of all new cancer diagnoses, and contributing more than 17,000 new diagnoses and 2,000 deaths among Hispanic or Latino men. Right here in Connecticut, if we were to look at the years 2016 to 2022, the number of Hispanic men that had prostate cancer was 187, 327 non-Hispanic Black men, and 2,251 non-Hispanic white men. So a total of almost 3,000 cases of prostate cancer. So we need to address this issue on several fronts, but in public health, what we always want to do is try to catch things before they get out of the gate. So you heard the story of how a prominent physician didn't take care of himself. Well, unfortunately, that's not a unique situation. Physicians are the worst at taking care of themselves in general, and always went into the profession to take care of others. And for many men, that's true too. They're always trying to take care of others. Well, this is a situation where you really need to go back and take care of yourself. And the simple thing of just really getting an annual physical is at least the place to start. Because when you go on to have more symptoms, potentially like burning when you urinate, or difficulty urinating, or having other pain when you're either having a bowel movement or when you're urinating, those types of things, or pain in your lower pelvis, that could be signs that the prostate cancer has actually gone beyond where you really want it to be. You really want to be catching it early. So this is all about prevention. And so what we're here to highlight today and to remind people about is that we have tools at our disposal. use them and go seek out the care, because you can't take care of anybody else unless you're taking care of yourself first.